icebreaker. The holidays are coming up, so if you'd also put your favorite holiday food in your introduction in the chat, we'd appreciate that. I'd like to let you know that we are going to record this community meeting, and we will be posting it along with a PDF of this slide deck on MHB's website immediately following the meeting. So as we get started, I'd like to take a couple of minutes to do a little Zoom housekeeping. We will keep you muted when you're not speaking. And so if you do unmute to speak, we ask that you remute. We're anticipating about 200 people joining us this morning for this virtual meeting. And so we want to keep all of the background noise to a very bare minimum. We'd like to ask you to use the raise your hand feature. It's found in the reactions near the bottom right of your screen if you would like to ask a question. So Denise will be monitoring those. We would prefer that you type any questions that you have in the chat. And we've built into today's meeting an entire section dedicated to questions and answers at the end of the meeting. So if it's possible, we'd like to ask you to hold your questions until the end so that we can make sure that we can get through all of the content this morning. So we will have people monitoring the chat for questions, and we'll be doing a facilitated question and answer session, and we'll give you those instructions as we get to the end of the meeting. If you're joining us by phone, if you need to remute your phone, you'll want to hit *6 on your phone. Okay, so let's go ahead and dive into this morning's agenda. So as you can see on the screen, here are our objectives. I'm going to do a little overview of the Mental Health Board and talk a little bit about our new theory of change. Kristen is going to talk very specifically about funding priorities for the upcoming grant cycle and our investment framework. And then Serena will be talking about the application process, what we're calling the fine print, along with Kristen, and then a few closing remarks at the end. Okay, we can go. Thank you very much. All right, so some of you may not be familiar with St. Louis MHB, so we're just going to take a few seconds and just give you an idea of who we are. So our organization was established back in 1994, and we are an independent government taxing authority. We're best known for the 2 special property taxes that support behavioral health services, and you can see those on the left of your screen. The Community Mental Health Fund, which was established in '94, and today what we're going to be talking about, the Community Children's Services Fund, which was established in 2004. And most recently, in November of 2020, we maxed out our fund, adding an additional 6 cents for every $100 of assessed value, and that monies are specifically dedicated to early childhood programs. So we also, in addition to administering those 2 tax funds, we seek out federal grants or other national foundation grants and use our tax funds as an opportunity to leverage funding and bring additional dollars into our community. We have 2 special initiatives that fall in our strategic initiatives area. They are the St. Louis Area Violence Prevention Commission, better known as BPC, and the St. Louis System of Care, which is a SAMHSA federal grant. On the right of your screen, you'll see the photos, the job titles, and the neighborhoods of our 12 trustees. And I do know that this morning we have our board chair, Linda Grayson, joining us for the meeting, as well as trustee Carla Rose joining us. So we want to welcome them as well. Just to let you know, if you're not really familiar with us, since we're a funder, we don't provide direct services, but what we do is support effective nonprofit service providers. And through the funding, we make more high quality, accessible services available to the residents of the city of St. Louis. We're basically on a mission to improve the quality of life for city residents by investing and participating in a coordinated system of social, behavioral, and physical health services aligned with community priorities. Okay, let's move on to our theory of change. So we're going to kind of build this out as we go. One of the outcomes of our new strategic plan was the development of a theory of change. And so the first thing that we did was we identified a long-term outcome, which you'll see at the right of your screen, as well as two intermediate outcomes. Our long-term outcome that we're striving to achieve is that St. Louis is a healthier and more equitable community when all children, youth, and adults feel safe, emotionally healthy, and socially connected. The two intermediate outcomes that you'll see in the circles, one targeted toward children and adults, children and youth, and the other toward adults. Children and youth build their social, emotional skills and experience safe and healthy relationships, strong and nurturing families, and bonds with school and community. Adults have skills, resources, and opportunities that support their behavioral health and experience safety and success at home, with purpose, and in community. The next thing that we did was developed 3 key factors. You could also call them preconditions that would need to be in place in order for us to achieve that long-term goal. The first one is policy and systems change. They reflect community-driven priorities, changes to the social determinants affecting behavioral health, and a shared regional vision of health equity and racial justice. Secondly, communities, services, and systems would need to provide increased access, increased care coordination, improved quality of care, and increased community capacity to shape outcomes. The third is that behavioral health services and prevention efforts are evidence-based and trauma-informed, driven by community priorities and those most impacted, and improved continuously. The next step that we did was to identify measurements that would document our success toward achieving that long-term objective. The first one is that young children are socially and emotionally healthy and ready for kindergarten. The second, children and youth's experiences of trauma and violence are addressed and reduced. The third, disparities in behavioral health equity and racial justice for people of color are addressed and reduced. And then children, youth, and adults with mental health and/or substance use conditions initiate and sustain healthy behaviors. The fourth step that we took was to identify both strategies and interventions that could be used to achieve the outcomes. So on the left side of your screen, you'll see 3 circles. You'll also see those 3 circles tying to our tagline with our logo. And so the first is partnering. By leveraging other funding sources and regional relationships, MHB supports multi-sector partnerships to build equitable, just systems of behavioral health and related services. Through investing, MHB builds capacity in the city of St. Louis through funding, relationship building, and technical assistance for organizations who serve the behavioral health needs of city residents. And through empowering, community-driven solutions inform MHB's efforts by highlighting gaps in equitable root causes and opportunities for innovation. The interventions, which are in the center and represent 5 circles with a 6th circle of people at the center, comes from a model and framework developed by the School of Social Policy and Practice at the University of Pennsylvania's Center for High Impact Philanthropy. They identified 5 strategies to address mental health and substance use disorder, and those we used to adapt to provide the interventions that you see. The first is focus on young people. As we know, intervening early can prevent, mitigate risk, or reduce the severity of mental health disorders or substance use disorders. And for those at elevated risk due to genetic factors or adverse childhood experiences, also known as ACEs, early diagnosis and connection to quality care can lead to better long-term outcomes. Help the most affected populations. People with serious mental health disorders or substance use disorders may require care at an increased level of intensity and consistency. For example, they may need immediate life-saving responses, as well as support in areas such as housing and employment to ensure longer-term stability. The third approach or intervention is to support the most serious disorders. Certain groups disproportionately experience mental health and substance use disorders or are more likely to lack access to appropriate care. Cultural, legal, geographic, and language barriers can prevent people from recognizing and seeking care or impede access to quality and effective treatment. Expand access to the full range of what works. Too few people have access to effective evidence-based behavioral health care. By increasing interventions and practices in clinical and non-clinical settings, we can ensure that all people have access to the full range of what works, as does strengthening connections between those two settings. And lastly, transform the landscape. Breakthrough progress requires transforming not only the way we think and talk about mental health and substance use, but philanthropy is uniquely positioned to fund higher risk interventions where a deep evidence base might not yet be developed, but where the potential for high reward transformative change exists. So that's how we hope to accomplish it. The very last thing that we did was examine the assumptions that we used to create the theory of change. Okay.
Hi, everyone. My name is Kristen Cohort, and I'm the Director of Children's Services here at MHB. And I just have to say, watching all the names come in the chat, it's so nice to be surrounded with so many friends and colleagues today. I know most of you on the call, and also you made me very hungry. So I loved reading all of your delicious holiday treats. We're going to actually start today by just providing you with a reminder of what the Missouri state statute can actually fund using these tax dollars. And I just want to make a quick note to note that the language here was created in the statute roughly 20 years ago, so it doesn't necessarily reflect language that we use today. So the statute dollars for the Community Children's Services Fund can cover and fund up to 30 days of temporary shelter for abused, neglected, runaway, homeless, or emotionally disturbed youth, respite care services, services to unwed mothers, outpatient chemical dependency and psychiatric treatment programs, counseling and related services as part of a transitional living program, home-based and community-based family intervention programs, unmarried parent services, crisis intervention services inclusive of telephone hotlines, prevention programs which promote healthy lifestyles among children, youth, and strengthen families, individual, group, family, professional counseling and therapy services, psychological evaluations, and mental health screenings. And quick note, it's important to know that the funds cannot be used for inpatient medical, psychiatric, and chemical dependency services or for transportation services. MHB's investment approach was created using evidence-based approaches consistent with our mission that Cassandra shared with you guys earlier. We use the needs assessment findings and recommendations as a foundation for the development of this approach as kind of a jumping off point of sorts. Then using many of the wonderful regional plans we have locally, as well as calls to action, focused on behavioral health, wellness, and recovery, we aligned this approach with community priorities. Additionally, we benchmarked our outcomes and indicators with other funders like the United Way, SAMHSA's recovery model, the DLA 20 domains, World Health Organization quality of life indicators, Missouri quality outcomes, as well as our own strategic plan and theory of change. So using this investment approach, we identified these following areas in which funding will be prioritized for fiscal year 23 to 25. However, I want to first take a quick step back to highlight a little more about Prop R, which established our newest funding opportunity, again, as an expansion of CCSF. In November 2020, St. Louis City voters approved to increase the property tax to its full rate and dedicate this funding specifically to early childhood programs and services for children ages 0 to 5. Engaging the community in our learning and decision-making is essential in achieving equity, which is the foundation upon which you heard Cassandra talk about our new theory of change. So we responded by seeking community input through surveys, community meetings, and a community advisory committee to establish the first kind of identified early childhood priority recommendations to take to our board of trustees. This process actually also helped us identify funding gaps and also to avoid potential funding duplication, as well as work toward what we're trying to do, which is design a more equitable and accessible application process. So you'll see in the first category of early childhood, we are seeking proposals that will, one, increase caregiver social emotional knowledge, tools, and resources. Two, increase family access to community resources, referrals, and support. And or three, increase the availability of behavioral health, prevention, and early intervention services for young children. I also want to just mention that you can find additional information on our website. We actually have a full PowerPoint presentation and recorded webinar that Keisha Hare, our early childhood coordinator, and myself put together with more detailed information specifically about this early childhood funding. So on the bottom half of this slide, you'll see in the second category, identified for all children ages 0 to 18, we're seeking proposals that, one, increase behavioral health prevention and early intervention services. Two, increase the use of family systems approaches. And what we mean by this is that they provide holistic family services that not only address the behavioral health needs of the child, but also their parents and caregivers. Three, respond to children and youth experiences of trauma and violence. And four, respond to the increase in children and youth mental health needs related to the COVID-19 pandemic. So another wonderful thing our theory of change also did is it helped us simplify our contracted outcomes. And these outcomes will actually also be aligned with our community mental health fund application process and application all together in around this time next year. A couple things that are important to note is you'll see that there is one box, the first one in purple, the one that identifies young children birth to age 5 are socially and emotionally healthy and ready for kindergarten. This is specifically for early childhood only. Now, the other 4 outcomes in the blue boxes are those that are going to be identified for kids 0 to 18. And you'll see these, I'm not going to read them only because Cassandra already read them, but just as kind of a connection point, these are also in the green boxes on the theory of change. So the 4 that Cassandra has already mentioned. The only other thing I'll mention about the outcomes is that each applicant will choose only one of these. So if you're in the early childhood space, it's already chosen for you. There's one outcome for all of those applications. And if you are applying for funding for a program that serves kids 0 to 18, you will identify one of the 4 in the teal box here. And then just one more thing that we want to highlight is our commitment to the funded partner experience, which is a regional collaborative approach created by the St. Louis Funders Learning and Evaluation Group Grantee Voice Committee, also known as FLAG. And I see some of my FLAG partners on today, so shout out to all of you. And our work focuses on the communication, grant making processes, relationship feedback, and most recently this year, racial equity regarding the funded partner experience. So the St. Louis philanthropic community who have adopted this funded partner experience approach actually envisions a future in which grant making is relational and funded partner funder relationships reflect strong partnerships that lead to long lasting, meaningful, positive change to the St. Louis region. Comprehensive information about this collaboration and our collective commitment is available on our website. And in addition, I'll just mention that we actually released our most recent report for FY kind of fiscal year, or actually calendar year 2021 this morning. So if anybody wasn't on that list and would like a copy of that report, we're going to have information at the end about our general mailbox. So feel free to send a request there and we can forward that report on to you as well.
Serena, you're muted.
Thank you. So thank you, Cassandra and Kristen, for getting us started with such important information. I will now provide details about our new application process. I will, of course, invite Cassandra or Kristen at any point to chime in if I misstate or omit anything. Also, as a reminder, because I'm sharing my screen, I cannot see the chat, but if you type your question into the chat when we get to the end of the meeting, I will be able to address any questions that may arise as I am presenting. So first, let's talk about why we decided to make these changes. Our old process was pretty great, so you could argue that there wasn't a need to do anything different. But MHB is actually a learning organization, and our goal is to listen to what our funding partners are telling us, to stay abreast of best practices in the field, and then use our own professional experience as staff who have led nonprofit organizations, who have been responsible for fund development, who've implemented programs of our own to inform our grant-making practices. So in short, we are serious about administering a user-friendly, effective grant-making process so that all of us can spend more time doing what matters most, which is serving children and families. So this slide illustrates the specific issues that we were trying to address: the length of the application, the length of the review process, and the inherent bias that written proposals often produce when comparing larger organizations who may have professional grant writing staff with smaller organizations who may not have that. The changes we've made also gave us the opportunity to amplify our organizational values by strengthening our focus on health equity and racial justice and aligning our funding with our new strategic direction. So these are the big changes that we want to focus in on first. Organizations may submit only one application for consideration. Exemptions may be made for current grantees, but these exemptions are by staff invitation only. One application is needed if you are doing the exact same program to serve youth and adults. So what does this mean? You won't need to submit a separate application in the Community Mental Health Fund cycle if you are proposing a program that has the same set of services and the only differential is the age range. We think this will reduce the reporting burden on organizations who are offering the same program to children and adults, and it allows us on the back end to ensure that we're applying the proper tax to pay for the correct service. So it takes some of that off of the organization. And I just want to emphasize that for those organizations that are new, it's important that you really think about the totality of the program that you're proposing. It can be comprehensive, but it can only be one application, so not multiple applications from the same organization. So this is the application process. It's 3 steps. They're pretty straightforward. The first is that there is an eligibility quiz, but we want to emphasize that this is not to screen people out. It is really to ensure that the basic requirements are met, that you are a nonprofit organization or that you have a fiscal agent, that you're serving children and youth from birth to age 18, and that you're serving St. Louis City residents. These are core requirements of the statute. So if an organization is not able to meet these requirements, then they wouldn't be eligible for funding. Once you complete this eligibility quiz, you will get login credentials emailed within 1 business day. So that step gives us enough information to know that you are eligible to receive funding, and at that point, you will have access to our online grant portal. Once you have access to the online grant portal, the next step is to submit a short application. And we're using the Missouri Common Grant application. We've modified it so that it's even shorter than the traditional application. It's about 5 pages total. There's a cover sheet. Your program budget is 1 page, and then your narrative is 3 pages. We will have a workshop in January where we go through the details of what is required, what the questions are. Today, we're giving you a high-level overview of the steps to the process. You'll also have the opportunity to upload your supporting documents, again, to verify your eligibility. So although you've taken a quiz that says you're a nonprofit, at this step, you'll be submitting documentation to actually verify that you're eligible. And then there's one page of assurances that will be available in the application portal. And we're also going to take time today to go over what's in the assurances document. And that's an effort to be transparent so that people know upfront what the requirements and expectations are, and you can make a better informed decision about whether or not this is the right funding opportunity for your organization. One thing that we've added in this step that we hadn't done previously is the opportunity to respond to follow-up questions. We know that written applications have limitations and that even the best grant application may be misinterpreted or misunderstood. So if we come across content that is unclear to us, the staff have the ability to go back, send questions to the applicant in order to seek clarification. There will be a window of time for applicants to respond to questions, and there will also be an opportunity to talk through the technical assistance phase if there are some specific things that require more conversation. But this is our attempt to make sure that we're not screening people out because of any error on our end in misunderstanding or of any small omissions. And then the third stage is the optional virtual technical assistance. So again, we want to make sure that staff are available and supportive, but it's not a requirement. If your organization has done this before and you feel confident that you can produce your budget and logic model and evaluation without any assistance, then you are welcome to do that. But if you would like to have an appointment with a staff member to walk through your budget and your logic model, then we make that available to you as well. In this stage, if you are providing adult services, we also make sure that you have the appropriate DMH certifications or designations as required by the statute. Once the technical assistance is complete, the applications, the logic model, the budget, the evaluation plan, all of the content will be required to be submitted in its final version by April 8th. And then we will use a review process to read everything that comes in to help us make recommendations. I also want to emphasize that we have used community reviewers in the past, but this year we're ensuring that we have community reviewers throughout the entire process, so they will be participating earlier on and really helping with the screening as well. So we'll have joint review teams that include members of the community, trustees, and staff who will review all of the applications in order to make recommendations. One other note for existing grantees, and this is just for planning purposes, is that you may be allowed to use your site visit if you choose to have a technical assistance appointment, to use that as your site visit as well. So that's just to throw that out so that it's on your radar. It may or may not apply to your organization. So this is the process timeline. And of course, there's a lot of detail here. And as we mentioned, we will post this to the website so that folks can review it as time permits. But to hit the highlights, today is the community meeting where we're making the announcement. After this meeting concludes, we will update content on the website so that everyone is aware of the new application process. On January 3rd, the grant portal will open for application submissions. And for those organizations that are currently funded, there will also be an opportunity to submit your quarter two reporting. And then on January 6th, as I mentioned, we'll have a virtual application workshop for all applicants. So we'll have a registration process similar to what we did for the community meetings. And for those who are not able to attend, that session will also be recorded and posted on the MHB website. And we'll also have opportunities for folks to ask questions through some virtual office hours, but that will be specific to the application itself. So that's not the same as technical assistance. And those virtual office hours will primarily focus on organizations that are new who are not currently funded and need some additional assistance in understanding how to use the portal, or some specific questions about how the application process applies to their organization. And that's one thing that I think we mentioned at the beginning, but just to emphasize, when we have community meetings, when we have virtual workshops, and it's a large group setting, our request is that the questions are general and applicable to everyone in the meeting. And if you have something that's specific to your organization, some unique circumstance, that we have those conversations with staff directly, so that what we do in the meeting is relevant to everyone in the meeting. January 28th, the grant portal closes. So you basically have a month to complete that short application. Again, it's 5 pages. As I mentioned, in February, that will be the opportunity for us to ask follow-up questions. And then for those organizations that are currently funded, you'll also be doing your reporting in February for your site visits. And you'll get more information about that from your project director. From March 7th to April 1st is the optional technical assistance. And then April 8th is the deadline for your final logic model evaluation plan and budget submission. I'm emphasizing that that's the deadline for the final. If you have chosen to take the technical assistance, if you don't need technical assistance, you can definitely submit those materials sooner than April the 8th. But April the 8th is the deadline for all final material to be in. Once we have everything in-house, our internal review process is that in April, those joint review teams will meet that I mentioned, that consist of trustees, community members, and staff members. Our operations team will also review your supporting documents, which would have been submitted throughout the process, but by the deadline of April the 8th as well. You may be contacted at this phase if there are any things that are unresolved, like a document that's not legible in the way that it was uploaded or something like that. But if you don't hear anything, that's okay too. It's a possibility, but not necessarily something that will happen for every organization. Then from May the 9th through the 17th, the trustee review teams will meet. May the 19th, the trustees will vote to approve the recommended applications. And by May the 20th, the applicants will be notified. May 23rd, applicants awarded funding and the contracting process begins. And our contracting process takes place in June, and with the intent that programs are ready to start by July 1st. So that's the 6-month process. It used to be 8 months. So we're pleased that we were able to reduce that time a little bit, again, to give us more time to focus on the actual work of serving community. So this is important just to level set, because as Cassandra mentioned at the beginning of the meeting, we had about 200 folks register. And when you do a request for proposals, you never really know how many organizations are going to apply, but this gives some historical context to what has been typical for this fund in the past. So in the past, we had a 2-step process. So organizations that were already funded submitted an intent to apply, and then new organizations submitted concept papers. And an organization that was already funded that had a new idea could also submit a concept paper. So in total, in our last grant round, we had 107 submissions. When we got to the application phase, 77 of those 107 were invited to submit an application. 74 actually completed their application. From that 74 applications, 36 of them were currently funded and 41 were brand new. So that's 55 unique organizations represented. That's important to note because what we have seen traditionally happen in most funding cycles is that about 69% or 70% of awards go to currently funded organizations and about 30% go to new organizations. And to just put that in concrete numbers, in the last funding cycle, about 11 organizations were new compared to 25 that were currently funded. So that just gives you some sense of the level of competitiveness for this particular funding cycle. So I'll talk a little bit about the eligibility verification, the supporting documents. Again, all of this information will be available for you to review before you decide to apply, but we wanted to make sure, in an effort to be transparent, that folks understood what will be required to use that as a part of your decision-making process to determine whether or not you choose to proceed with the application process. So we'll definitely need to confirm that you're in good standing with the IRS. We'll need to see that there's a certificate of good standing to do business in the state of Missouri. There will be insurance requirements. So this list gives an idea of the specific insurance requirements that we will be looking for. We'll be looking for your Form 990 as well as your tax exempt status letter. We'll be looking for a financial audit and management letter from your past fiscal year. And then if you are providing services for adults and there's a requirement that you have accreditation or a letter from the Department of Mental Health, that will be something that you would have to have by April 8th. So that's not an after the fact item. And then for your staff to actually have the appropriate current licensure or certification to provide services in the state of Missouri. So emphasizing that this is due by April 8th, because if you're a new organization or a new program and you don't have these things in place already, you need to think about whether or not they will be available to you by the time you choose to apply. All right, I'll turn it over to Kristen.
So now we're going to shift gears from understanding the application requirements to what we're calling the fine print, to ensure that we're explaining the funding requirements as clearly as we can. Ultimately, MHB makes the best choices it can with the information available, but just to be clear, like any document, it's not possible to anticipate every possibility. This may mean that we still need to make adjustments along the way, and we just want to make sure that everybody knows that anytime we need to course correct, that we will be sharing that openly and be as transparent as possible. So our disclaimers listed here outline MHB's legal authority to make changes as needed to achieve the best possible outcomes for the community. And in plain language, what this statement essentially says is that the competitive funding application process can be amended, modified, or canceled at any time, that any and all applications can be rejected, formalities waived, and then applications selected at MHB's sole discretion in the best interest of MHB as allowed by state statute or regulation. That applications which are inconsistent with Missouri state statutes and regulations, City of St. Louis ordinances, or MHB policies and priorities can also be rejected. That specific terms of an application can be negotiated. Supplemental information or documentation from applicants to clarify or verify information provided in the application may be required. The competitive application process does not mean that MHB must select an applicant or pay any expenses associated with the application preparation. And finally, that essentially any of the above can happen at any time without notice and without liability, and MHB is not responsible for any associated expense. So next, we want to share a high-level overview of our community investment policies. So all funded organizations must demonstrate stability and responsibility in terms of finance, administration, and management. They must follow all local, state, and federal requirements or regulations. All individuals receiving clinical mental health services require a documented diagnosis, but just to be clear, this does not apply to those receiving prevention or early intervention services. That culturally and linguistically appropriate services must be provided. That all services must be provided in a content neutral manner, which means it cannot be used to support any religious education, service, or mission. And on the next slide, thank you. MHB funds cannot duplicate any other funding received. Specific eligibility requirements for the Community Children's Services grants and potentially Community Mental Health Fund grants, if it's a hybrid request, on slide 18 that Serena just explained, must be met. A maximum request of $500,000 may be made per program per year. So max 500,000, and a maximum request of 100,000 may be made for a new or startup project in year 1. So this, just to be clear, this doesn't mean a new grant to us. It means a new project for the organization. If your program or service requires any kind of certification or licensure, just to be clear that MHB does require verification of these credentials, which you heard in that eligibility requirement side. And on a final note, just that it is preferred if funded organizations are accredited whenever possible, that board members for organizations reside in the city or county, and that service delivery ideally occurs in the city of St. Louis.
Okay, so I'm going to just circle back to the assurances that I mentioned before. Again, you will see this when you are preparing your application. And this is actually a requirement to be submitted with your application. But essentially, it verifies that as an organizational leader, you understand the requirements and the commitments for the partnership between your organization and MHB. So you're saying that you have the legal authority to apply, that if you are selected and awarded a grant, that you will actually make your records open. So we talked about site visits a few times, but we actually do come and verify that there is appropriate accounting systems and protocols in place to be able to track how funds are being expended. We do require financial and compliance audits. And we also want to make sure that organizations understand that they're responsible for managing any conflicts of interest or personal gain that may arise when they're going through the application process. This is spread out on 2 slides, but when you see it in the portal, it's just one document. You're also assuring us that you will maintain participant records. And I'll pause here to say that for those who have known MHB for a while, we've used the word consumer previously, and we're transitioning from consumer to participant. Organizations can use whatever word is natural for the way they describe the relationship with the folks they're serving, but you'll see less of consumer language from us and more about participants. The next pieces are to align with federal requirements. So you will comply with federal statutes relating to non-discrimination. You will comply with the USA Patriot Act. And then, of course, requiring all of organizations to comply with federal, state, and local laws that relate to the project that you're conducting. So this is not atypical, especially if you have any experience with federal grants. These are just things that are expected for organizations to ensure that they're adhering to sound business practices. So whoever the signing official or the authorizing signature for your organization would be the one that confirms these assurances during the application process. We also want to give you a preview of the grant requirements. So once you are selected and you have a contract, we will go over this in much more detail, but we want to make sure that people are aware that there are requirements around reporting, that we have semi-annual reporting. And what that means is that in January, you will be reporting on quarters 1 and 2, so 6 months of information. And then in July on quarters 3 and 4. And in the reporting, there's a program narrative that really focuses on whether or not you're making progress towards achieving your outcomes. There's also the expectation that you include participant data, as well as a stewardship report, which is basically the financial report that shows how you are tracking your spending. We talk about having a 3-year grant cycle, but there is a renewal application in grant years 2 and 3. And that's really just to ensure that if there is a need to revise or update your logic model, that you have the chance to do that, and that you can also propose budgeting cost of living increases as needed for staff. All required supporting documentation also has to be up to date and current every time you complete the renewal application process. And then we have an annual site visit And during the site visit, it is a discussion between the program staff of your organization and then our project directors, just to make sure that we understand how things are going and whether or not any supports are needed. That's when we do the verification that I talked about, at actually reviewing material that you have within the organization to support your stewardship report and your participant data. And it really focuses on other contract compliance questions. So again, this is something that you will get much more information about when we get to this stage, but we want it to be as transparent as possible and provide this information up front so you wouldn't be surprised that these requirements are expected. So at this point, we've presented all of the material we have, and I'm going to stop sharing my screen so that I can see everyone. But before I do that, just a reminder that we're asking you to ask questions that are pertinent to everyone and not your specific project. And there are two ways to ask questions. One is to type your question in the chat, or use the Zoom raise your hand feature found in the reaction section to be unmuted to ask your question. And then if you're on the phone, you can unmute yourself to ask your question and then remute. So I'm going to stop sharing, and I believe we may have some questions that are already in the chat.
Ms. Serena, Ms. Cassandra answered the question related to how they get a copy of the slide deck and a PowerPoint. There's a
Just to reiterate really quickly, the question was asked, would the PowerPoint be available? Would the theory of change in a readable size be available? So all of those will be posted to our website following this meeting, as well as a recording of this meeting.
All right, so I can now see the chat. And I'm going to start scrolling, but Denise, if you've already noted a question that you want us to answer, feel free to read it out.
Okay.
Right now, I'm reading a lot about food. So let me keep scrolling.
One of the questions asks about, as it relates to one application now for the adult cycle and the children youth cycle, can you talk about the overlapping cycles if it's just one application?
Yeah, so I can try to clarify that. The intent is that if you have a program that is the same program, but it just happens to serve children and youth, then you would submit one application in this cycle, and your narrative would describe what you're doing for children and youth. Your budget will include the costs for serving children and youth, because it's essentially one program serving different populations. However, if your organization is currently funded and you have two programs that are completely different, and you're trying to figure out, well, can we submit two applications? Your project director will contact you to talk about your options, because your project director knows which organizations already fall within that category.
Ms. Serena, are there any organizations that are not eligible to apply, for example, if from a school?
So organizations that are not eligible to apply, if you are a for-profit organization, you cannot apply directly. For schools, we actually partner with community-based organizations to provide services in schools, but we don't fund school districts directly.
The next question was, the next question was for organizations that have multiple funded programs, when will they hear from project staff on if they need to submit one application or multiple applications?
So there actually aren't very many organizations that fall into that category. So the assurance that we will give you is that you will hear in enough time to be prepared to apply. But with schedules the way that they are, I don't want to commit to a specific date.
With the eligibility criteria being that you must serve city residents, if you're not already serving city residents but want to expand your services, are you eligible?
Yes, you just have to be very clear in your proposal that you intend to serve city residents.
Would you fund the project if it provided support to mental health professionals as it relates to their professional development of educators, caregivers, or families?
So that would be something that's more suited for our community mental health fund. I want to clarify, when we talk about the ability to do adult services in this cycle, it's focused on intergenerational programming. So you're working with the family as a unit. It's not you're solely working with adults or you're solely working with parents and caregivers. So just be very clear when you're submitting your proposal that if you're serving adults, it's in relation to the family unit. So intergenerational programming and family-focused services is the intent. And then if you also have a program that does the exact same thing, but as soon as someone turns 19, in the prior model, they wouldn't have been eligible. Now they would be eligible because we're braiding those two funds, the Children's Service Fund and the Community Mental Health Fund.
All questions in the chat have been answered.
I see a few questions that just popped up. And I'm going to defer to Cassandra on this question. Are individual independent schools eligible to apply? That's a question in the chat.
I think it really depends on the programming. So what I would encourage you to do is to participate in the office hours that are going to be offered in January on consecutive Thursdays, so that we can talk with you individually about your unique circumstances. The reason that we aren't able to fund an entity like St. Louis Public Schools is that it's also a tax-supported entity. So we can't directly fund the public schools, but we typically fund service providers who are often embedded providing services in schools or serve city school children. So that's really kind of a unique circumstance, and I would encourage you to speak directly with one of our staff. We also serve, we've also funded the St. Louis Public Schools Foundation, which works with St. Louis Public Schools. So those are some unique circumstances, but we're happy to talk about those with you offline.
Will you have a community mental health fund grant cycle?
Yes.
Okay, yeah. Let me elaborate on one thing that Serena mentioned. So one of the big changes that she's talked about is reducing the necessity for an organization that literally delivers the same program to people throughout their lifespan to have to apply in 2 cycles. The second thing is shown in the funding priorities, and I want to kind of reiterate that. What we're trying to do is reduce a barrier that's been in existence. And so in the past, children have needed behavioral health services, but there's always been difficulty being able to serve their parents if they also have behavioral health needs. And so what we're trying to do with making this opportunity available is that you're not just able to serve the child, but you're able to serve the parent or caregiver's mental health needs, so that you're not serving the child and placing them back into an environment where those environmental factors will continue to impact them. So it's really kind of twofold when we talk about family focused and intergenerational services.
So I see a question in the chat about, is the intent to apply for existing programs still due tomorrow? No, nothing's due tomorrow.
What is the floor and ceiling for funding?
Kristen, I think you had a slide about this. I don't know if you want.
Yeah, so the ceiling is essentially, again, for an existing program, $500,000 a year. We don't have a floor. However, you've probably noticed there are a lot of kind of layers and elements that are required for this grant funding. So I would recommend that the floor that you choose is something that is equitable with the amount of work that it takes to implement this grant for your organization. And again, the ceiling for a new program or project is $100,000. Again, not new to MHB, but new to you. Something new that you want to expand into is $100,000.
One of the things that I think that people will also be interested to know is just how much funding do we anticipate being available? And so in the past, on average, we typically had in the competitive process about $6 million. But now with the addition of the early childhood funding, which is estimated to be somewhere around 2.3, 2.4 million, I think it would be safe to say that we are anticipating funding to be available somewhere in the range of between $8 and $9 million. We will have more definitive information as we get into the cycle because the taxes actually have to be collected before we know that specifically. And so most of the revenue from taxes comes in 3 months, comes in December, January, and February. And so in February, we will establish the amount of funding that is available. And so we anticipate that it will probably be pretty close to $9 million.
How do you sign up for one of the January consulting time slots?
So just to clarify, the January slot is for organizations who have questions about the application process. So you have some concerns about the portal, or you're trying to figure out how to upload something, or whether or not what you're proposing matches. It's not the same as the technical assistance. So you may not need to sign up for a January slot. The hope is we will do the presentation on January 6th and provide the recordings that it will actually have videos, step-by-step instructions on how to use the portal. So that's kind of the first opportunity to understand how to apply. And then after all of that, if you still have a question, we'll have opportunities for you to meet with staff. And those are about 20-minute consults just to kind of troubleshoot things. But that's not the same as the technical assistance for the actual application preparation that we talked about with the logic model and budget in March.
And I can just add really quickly too, my colleague Lisa Potts and I will be doing those collectively together, and they will be on those Wednesdays after that meeting, the 3 Wednesdays in January between 10 a.m. and 3 p.m., again in 20-minute increments. So just if you want kind of just a what to look out for, and there'll be a Sign Up Genius link that will be on our website after the application webinar.
Someone need to ask their question as it relates to St. Louis Public School Foundation. So we need more clarification as to what the question is as it relates to the St. Louis Public School Foundation.
I think they were just saying that we also support the St. Louis Public Schools Foundation. I remember when that was typed. But now this question from this follow-up question about how do we know if the program is appropriate, you can contact us and ask questions. If you have a specific question about your program or your organization, what we're saying is that this meeting is kind of general information. But if you have a question that's specific to your organization, you can contact us.
I'll take the next one. Someone is asking, could you remind me when the Q2 reporting is due in January for current funded partners? So it's always available in your contract amendment, but it's due on January 14th. It's in the timeline that will be posted after the meeting. And the second question is, do you know when the Community Mental Health Fund grant process will start, or have more information regarding that right now? That process will start at the same time in 1 year. So the 2 funding cycles are stair-stepped. This is the children's cycle with opportunities, for intergenerational, but the adult-focused only cycle will open in January of 2023, and will be very similar process to what you see and have heard today.
So I see Karen's question. So the January 6th workshop is not required, but it's strongly encouraged, especially if you've never used the grant portal before. The purpose of the January 6th meeting is to go through how to actually access and use the portal, but more importantly, the questions, like what it is that we're going to be asking of you as an applicant. So it gives you a preview, and it gives you the ability to also ask questions in that meeting. We think our questions are clear, but you might say, well, what do you mean by this or that? So, you know, it gives you an opportunity to talk to us about the application itself. If you missed that meeting, again, it'll be recorded. You'll have the opportunity to submit questions and get those responses sent back to you. So it's not the only chance to find out what's happening, but it's the first opportunity to really get a look at the application and the grant portal. So all funding is for 3-year cycles. So if you are a new organization and you have a new proposal, you should be thinking about it as a 3-year project. And your proposal should describe what's happening each year. Your budget should be accounted for each year. So yeah, it's a 3-year process. And I am going to share my screen for one last thing, which means that I won't be able to see the chat. So someone else can alert me if there's something I'm missing. And this is just more information on how you can ask questions. So if after this meeting something pops up and you said, I wish I would have asked that, you can email your questions to this email address. We will be responding to questions through Tuesday, December 21st at 4:30 p.m. So we'll be monitoring the email. We'll answer the questions and post those questions to the MHB's website every day. So you won't get an email response, but the responses to all questions will be posted to the website so that everyone has the benefit of seeing the question and the response. And we will do that for about a week. So December 21st is the last day to do that. And again, this is intended for general questions, not for specific questions about your organization. And I also put that address in the chat. All right, I will turn it over to Cassandra to close us out. I don't see any other questions coming in.
Thanks, Serena. So, as Serena mentioned, we will be monitoring those questions. And so I think the one thing that you'll find is when the actual application opens on Monday, January 3rd, that all of the content that we discussed today, the assurances, the information about eligibility, all of those kinds of things will be available directly in the portal. So we make sure that all the questions are there along with the recording. So you should be able to literally go into the grant portal, go through the eligibility quiz, and within one business day have access to everything. And that's the reason that we do the application workshop a couple of days after the application opens. The intent is that you can actually go in, take a look at it, and hopefully come to or participate in the virtual application workshop prepared with specific questions about how things work. And then we'll have the office hours. So we want to make sure that you feel that we are accessible to you throughout this process, and we will endeavor to answer any questions that you have so that we can make this process equitable and accessible for everyone. And so we hope that this information has been helpful to you this morning. I want to thank all of the trustees that have joined us. I want to thank all of our funded partners, and I want to especially thank anyone new who's joined us to consider applying for this funding to serve city residents. So it takes a village to do all of this, and I want to offer our great appreciation and thanks, especially to our staff who've helped put this together this morning, to Serena, Kristen, Denise, and Sue, and the rest of our staff that are joining us on the call today. So thank you very much. We look forward to hearing from you and to partnering with you to serve our community. Thanks a lot. Have a happy holiday.